Hi, everybody. Welcome to Eye Care Specialists. This is our cataract webinar. In our attempt to social distance, as we're supposed to, we decided to hold a webinar. We do want to assure you that we're doing everything that we can to, and following all CDC guidelines to make sure your visits to our office are safe and comfortable. As a special thank you for all attending tonight, we will be doing a raffle and giving away a free pair of sunglasses valued at $200. They can be picked up at any one of our 8 optical shops, and we'll let you know who the lucky winner is. If you would like a counselor to call you to schedule an individual consultation, you can just type your name and your telephone number in the chat bar at any time, and we will get back to you. So here's how to ask a question if you're not familiar with the chat bar. At the end, we're going to be answering questions from the audience. So please type your question in this chat bar. If the control panel is not fully displayed, you can click the orange arrow. Type your question in the chat or question box and click enter or send. And you may ask as many questions as you would like. Eye Care Specialist is comprised of a large group of highly trained optometrists and ophthalmologists. They are committed to excellence in patient care and are leaders in the medical surgical eye care field. We have 8 locations throughout northeastern Pennsylvania and our own fully accredited surgery center. We'd now like to introduce you to our 5 cataract surgeons. We're going to be meeting Dr. Reiser and Dr. Roth live tonight. But we also have Dr. Donald Savage, who does cataract surgery, and we have Dr. Daniel Letts and Dr. Robert Zaborski, both of whom are also glaucoma specialists. And they can also remove your cataracts for you. Dr. Roth will be one of our presenters tonight. Dr. Roth is actually a dual board certified surgeon. Not only does he do cataract surgery, but he does laser cataract surgery. He does all the advanced lifestyle lens implants that we're going to talk about tonight, but he's also dual certified in oculoplasty surgery. So he can do cosmetic surgery, eyelids, facial surgery, and aesthetic procedures. So he's the guy you want to get to know pretty well. We also have Dr. Harvey Reiser presenting tonight. Dr. Reiser does cataract surgery. He also does laser surgery. LASIK surgery. He has been instrumental in getting lenses approved for usage and has been a pioneer in the field of the upgraded lenses. He also treats diabetic eye disease and does retinal lasers when needed. And now, without any further ado, I'll turn it over to Dr. Reiser and Dr. Roth.
All right, so let's get started here. Tonight we're going to talk about modern day cataract surgery. We'd start off, we have some basic things to talk about what a cataract is. We'll talk a little bit about surgery. And probably the most exciting thing is about the options you have in current modern day cataract surgery. So I think at this time we'll start. Kind of people all the time ask, what is a cataract? They'll come in, and as you can kind of see what happened right here in this, on screen here, you had the headlight of a car when it's brand new, it was crystal clear. And now it has become yellow. And that's basically what happens to the natural lens that's found in our eye. And at some point, when that color change of the lens gets to a point, it starts to cause us visual problems. Sometimes your vision is just not as clear, or you have glare or halo at night. And that's really what a cataract it is, and that is the most common thing that we experience. So again, here you can see what a cataract is. On the upper left here, you can see where there is no cataract right here where my pointer is. It comes back. You can see that we have a nice sharp E, the letter E, typically what you see when you're in the exam. So if you come over to the next picture, what you'll notice, it's blurred at this point. And what basically has happened is that lens in front of the eye has become yellow like we just showed you in that picture, and it causes your vision to be blurred or scattered. So why don't we go ahead and proceed on.
So a cataract causes blurry vision, faded colors. You may not notice the colors being faded. It happens over many years. But when you have your cataract removed and replaced, you'll notice the brightness of things. All of a sudden, it's like the whole world got painted with white and blue colors because it just gets very vibrant. Sometimes people come in and say, I have double vision or ghosting of images in addition to nighttime disturbance. So it can present itself in many different ways, but generally it's affecting your vision and you're not, in this case, not seeing the level that you'd like to see and would like it improved. Thank you. Keep going. So on the right, we're seeing someone who has no cataract. Headlights, while bothersome, are of a normal size. On the left, we see the glare, the diffusing of light, making it more and more difficult to drive and stay in the lane. That's real typical. Rich Roth and I, we see a lot of people that complain about driving at night. That's a very, very typical early sign.
All right, so why do cataracts develop? And really, probably you can see we have in the boldest letters here is it's an aging process. So the lens we're born with at the beginning of our life stays with us throughout our life, and of course it just changes. And that by far is the most common thing that causes cataracts. The other things we can see, genetics, exposure to sunlight, medications, injury, disease, smoking, they're all very small. Definitely as we move along in life, aging is the main process that causes our cataracts.
If you look at people that are over about 75 or even say 70, you generally track, and if someone's 70 years old, they have about a 70% chance of having a visually significant cataract. So we see cataracts in kids and young adults, and more so a cataract in its early phases, we deal with it earlier on, but it really is just primarily aging. I think the rest of the things on here seem to be pretty minor.
Right, and I think also what you need to be aware with, we are, cataracts do affect us in our 40s and our 50s and 60s. So, a lot of times someone will say, well, I've told I had a cataract and their vision is gone, they've got new glasses. So years ago, we waited till cataracts were very advanced. Now, really, the time that when we think about cataract surgery is when we're starting to have symptoms of that glare, we're having difficulty with our vision. So even though we think of it as a process of, senior years, there are times, even in our 40s and 50s, where we need to address these.
Yeah.
Go ahead, you want to take it?
Sure. So when I first started about 30 years ago at Wills, we used to make real big incisions. So you'd really want the cataract to be very ripe. And the word ripe or mature was important. And that's because we kind of squirted the cataract. This is going to sound a little funny, but like the pea out of a pod. So you make an incision in the eye and tease the cataract out, again, like a pea in the pod. And we had to close it with multiple stitches, and the recovery was long, was not insignificantly uncomfortable. And sometimes if we couldn't put an implant in, and if you remember back, at least I remember back when I was a kid, so you're talking 50 years ago, people would wear these real thick glasses. So that's old, that's not happening, but understandably you would be more fearful. We can jump ahead.
So, when we just talked about cataract, and here are some facts that I think are very enlightening. So if you think 20 million Americans are over 40 years of age have cataracts, as we just discussed. It is the most performed surgery in the United States and probably worldwide. 50% develop cataracts by age 65 and over. But the real important line here to take away is, is just as Harvey was saying, where cataract surgery used to be a very scary thing, it now has over a 99% success rate. So, for a procedure that's being performed so much, it affects most people in America and around the world, it has a very high success rate, which should be very assuring.
Yeah. Now's an exciting time to have cataract surgery. Here we go. Let's talk about the good stuff, okay? So you have options. This is the one time in your life that you get to think about how you want your vision for the rest of your life. So you get to reset what you have. If you've been wearing glasses your whole life, because you're nearsighted, we can change that. So there's now available laser-assisted cataract surgery instead of bladed surgery. We can now treat astigmatism, or we're going to talk about what that is, and we can really cut back your need for glasses. And you get to decide what you want. Do you want to wear glasses at all? Do you want to wear them just for reading? We can help you achieve what you'd like.
Here we go. So one of the big things that we talk about in cataract surgery today that's exciting that we can treat is astigmatism. So, you know, cataract surgery in the past, we removed the cataract, we put in nice new lens in the eye, but we weren't able to treat astigmatism. So you had a new lens in your eye, but your vision was still blurry in many cases. And why is that? So astigmatism is kind of a structure of the eye. See there, we have what's called a basketball or a football. So really your eye can either have a shape as a round basketball, and if you look at the image below that, what you should think about is just like when you bounce a basketball, it can come straight back up because the curvature on that ball is the same everywhere. So light that hits that round eye like that all focuses at one point. So if you see on that slide, the little red dot at the back of the eye, all the light coming into the eye is able to be focused into one place. Most people have some degree of astigmatism. That's on the right. So what does astigmatism mean? You have more of an oval shape, or what we would say a football shape. So what does that mean? When light hits a football or an oval shape, it's going to have two curvatures. You have the soft side and you have the very round side. So it causes 2 points of light to be focused into the back of the eye, as you see by those two red dots. So neither of those dots are focused together on the back of the eye. So even though we've removed the cataract and you had a new lens implant, your vision afterwards was still blurry in some cases. So now that we can treat astigmatism at the time of cataract surgery, we're able to adjust not only the cataract, but also the refractive outcome of your vision, making it sharper. Doesn't mean that you can't wear glasses, you can't use glasses, but the overall quality of the vision by treating it at the level of the eye or inside the eye is going to be much better for astigmatism management than using glasses on the front of your face. Think about if they're tilted or they're too far down, you're not getting the proper focus. So why don't we go ahead and move on to the next slide. And this is a picture, kind of what we were just talking about. So on the left, you see that the colors are kind of washed out, nothing sharp. And then you go to the middle picture. Well, that's someone who had cataract surgery, but the astigmatism of the eye was not addressed. So while the colors are more vibrant, more light comes in, things are still blurry, okay? So yes, you could wear glasses or something like that to treat that. But on the right, now this is an eye that not only had cataract surgery, but also had their astigmatism corrected at the time of surgery. And what you can see is now you have the bright lights, you have the crisp colors, but also the detail, the picture is much better because your overall quality of vision, you know, high definition, what we're all buying TVs these days, is in front of you.
So basic surgery, I tell people there are three choices in regards to cataract surgery nowadays. This is the first choice, what we're going to call basic surgery. This is older technology, like 1985 technology. It is good surgery, but it's not as good as we can do. So it's outdated. That's all there is to it. It's like all the technology around us. If you're buying a brand new car, would you buy a brand new 1985 car? Maybe you would, but if you buy the 2020 car, you're more likely to have side airbags, protection against impact, collision, etc. So basic surgery is bladed surgery, a routine lens implant, not customized to the eyes. We are not fixing astigmatism, and you may well need glasses for all tasks, distance, intermediate, and near. As an example, a basic outcome here, this is meant to show you a blurry background. This is without glasses, a blurry background for the distance, and a blurry background for the phone, because things like astigmatism are not corrected in this case.
And we can proceed on. So then you have, as Dr. Reiser was saying, you know, you have 3 levels of cataract surgery: basic, and then we really get into advanced custom cataract surgery for your eye. And what's the advantages here is that we're using the latest technology. In this case, we may use laser-assisted cataract surgery or no blade to make very critical incisions during the cataract surgery. We have advanced lens implants, some of these for astigmatic correction, and we'll talk in the future about also giving you a fuller range of vision, where really we're trying to give you not only your distance vision, but looking at your computer and looking at your phone and really having some freedom there. Additionally, in this case, we correct the astigmatism because we know how much better that makes the vision. So really, when we do advanced custom, our second level, when we're doing this advanced cataract surgery and we're customizing it, we're really maximizing the vision for the distance or near, so that you're not using glasses for one or the other. Sure, most people, and there was a large study actually done, and it was done through Google, most people really prefer to have great distance vision and wanted to use more reading glasses for up close. And here's a perfect image of that. So what you can see here in the distance, you have very sharp, you can see your lake, you can see the beautiful forest across and the sun and the sky, but still when you go to hold up that device in front of your eye, or you know, if you need to look at your watch or your compass, if you're lost with your kayak there, you might have a hard time seeing it. And I think that's really, you know, one of the things that's really important for you to think about is, as we move forward, and we're going to get into this now, device management. As our life moves more and more to using cell phones, special digital watches, looking at computers, looking at our iPads in our homes, really that intermediate and near vision is becoming much more prevalent in our life, less than probably looking at newspapers. But why don't we go to the next slide? And here is one where we customize the surgery, this time for up close, so everything is close, but in the distant things are blurry. So again, you have great customized vision either near or in the distance, but you don't have both, so you still need a little reading aid for one or the other.
So that's the first step up in advanced cataract surgery, where you're maximizing either distance or near and wearing glasses for the other one. Okay. Visual freedom is, again, like we just mentioned, laser-assisted cataract surgery is available, advanced lens implants, astigmatism correction, and now we're trying to minimize all glasses, giving you back distance and near. So that's why we call it visual freedom. The reason why this exists is because people, when they would see well in the distance, they'd often say to us, wow, I'm great far away. And what they mean is really 4 or 5 feet and out is pretty good. But every time they come inside that area, they always have to grab their readers. So it's inconvenient. That's why this package exists, to try and give you back distance and near, to try and minimize glasses. It doesn't always eliminate them, but the goal is to eliminate them. And with today's technology, we really can get very far along. Go ahead. And this slide is trying to show that. So we have good distance and we have good near, and that's the best. That's what I think most of us would rather turn the clock back to before 40 years of age and see well in each location. Go ahead.
So when you take a look at the results, and we again talk about these 3 different levels of surgery, you know, we have basic cataract surgery, again, using past, you know, older technology during that time. And you'll probably need glasses for most tasks that you perform. Then we have our intermediate, or what we call advanced custom surgery. We're really focusing on either great distance vision or up close. And then we have the highest level, where we're really looking for visual freedom, reduce the need for glasses, and really give ourselves a quality of life that most of us haven't. You know, if you think about it, if you started to use glasses when you were young, that's one thing. Most people start using them in their late 30s or 40s for others. So really, it's all of a sudden, it's, you know, when you talk about rejuvenated things, this type of package really is rejuvenating, kind of giving us vision that we either wish we had had earlier or gives us the opportunity first in life to have it.
And this is kind of like LASIK for younger kids, that is people under 40, where they're trying to maximize their quality of vision. basic surgery, I really don't recommend. When I talk to people, I generally don't recommend that. And the reason why I don't is not because for anything other than the fact that the technology is just better today. However, it's the least expensive, and in that regard, it's the best for that particular need. We'll get into that a little bit more. Let's go ahead and jump ahead now. So your procedure, it's changed. I mean, it's an outpatient procedure done in a surgery center rather than a hospital. You're awake and comfortable and relaxed. So we give you some mild sedation to take the edge off. Everyone's nervous, that's normal. The idea of having your eye operated may be somewhat scary, but the actual experience is not bad. It's generally a 10 or 15 minute procedure. We do it under eye drop anesthesia, no needles to make you numb. We don't use stitches typically at all or sutures. You don't have to change your clothes, so you dress in something comfortable. And you're back to most activities as soon as the next day. So it takes a couple days to get the vision back to a large degree, but you're able to do most things except for rubbing your eye or getting it soaking wet or lifting real heavy things almost right away. Go ahead.
Okay, here we go. Going dropless. So one of the great things I think Dr. Reiser and myself have instituted here at our eye center is that we do what we call dropless cataract surgery. So you might have had friends, or you personally might have had surgery yourself on one eye, and in the past we would start having you use a drop the week before surgery or a couple days, and then you would be on eye drops for about 4 weeks afterwards. And a couple of the problems with eye drops are, first of all, we would prescribe one type. You would go to your pharmacy, they may not have that, or it may not be covered by your insurance, so it could be expensive. Two was people would lose their drops, or quite frankly, they had cataract surgery and their eye was feeling pretty good, so they weren't using their drops as often as they should, so they would get a little irritation or sometimes, inflammation on the eye. So we actually followed two large studies that were done, one in Europe and one here in the United States, and they had thousands of patients in it, and actually showed that if we applied the medicine inside the eye and around the eye at the time of surgery, that patients did as well, if not better, by having that treatment. So we have moved our practices forward, just like the technology of cataract surgery, but in our care, and we do what's called dropless cataract surgery. So at the time of surgery, we'll actually place some of the medicine inside the eye, but we'll also place some of the medicine under the skin of the eye so that you afterwards, in most cases, you do not need to use drops. So it's a significant cost savings to the patient. As it says here, it reduces the risk of infection, and it's incredibly convenient and simplicity for you.
A really big change forward. So all the hassles of getting drops, getting someone to help you put it in, missing your eye, getting frustrated, forgetting the drops, that all goes away. And again, that reduced risk of infection is by a factor of 10 times. So it's really a nice step forward for the patients and for us too.
In certain cases, you may need a drop if you are diabetic, or we see something that feels, we may have you one drop, but even if you're using just one drop, before you would have to be on 3 drops.
Yeah, right.
So it's still a wonderful improvement. And when we started doing this over a year ago, it's amazing how the patients have come back. And actually, we've had some patients come to it saying that, I hear you do dropless cataract surgery. It's wonderful. So it's been received, I think, both by the patients, but it's also great for us. Sometimes when we prescribe medicines, we weren't sure which prescriptions you were specifically getting based on your healthcare plan. So we know exactly what medicine you're getting now and the dose. So laser-assisted cataract surgery. Here's a picture of Dr. Reiser himself doing getting the laser lined up for a patient. Right. So here it is. And the important things is, the laser comes down. I will let you know, I've had cataract surgery, had laser cataract surgery, because I did think it was warranted. It's a little pressure, does not hurt. Eye care specialist here was the first in the area to perform laser cataract surgery. I think it's been 7 years that we've been doing it now.
7 years.
So, and this again, the laser continually gets upgraded. There's new programs, new formats. It gets quicker, more precise. So we've had a great experience with it. Why don't we go on to the next? Affordability.
Let me touch on this.
Sure.
So insurance is going to be applied to any of the options that we've talked about tonight. So that'll be the same for all. There is out-of-pocket expense if you upgrade from basic. So you step up into advanced cataract surgery, there'll be some costs. And we try and make it as affordable as we can. We have costs associated with these extra steps we're going to do. There are payment plans. We offer 0% interest with care credit. And really, most of the time when we're done, I think most people will say, wow, you know, how valuable is your site? How nice is it to see as well as you can? It's pretty much something it's hard to put a number on. So it's something, this is the, as I said earlier, it's the one time you get to think about what you want in your vision for the rest of your life. So give it some thought. If we can make it affordable for you, to me, it's a no-brainer. At the same token, if it's not affordable for you, you should do the basic surgery, and we're fine with that.
So we kind of, you know, I think sometimes it's when you come in and it's discouraging that insurance doesn't cover everything, but I think sometimes you have to put a little value on what upgrading the surgery would cost. And if you just take a look at basic things that we use in life, and you look at on a monthly basis, you know, your cell phone there, you can see 140, and these are, we had these for local prices here in Northeast Pennsylvania. So a smartphone at $145, cable TV at $123, car payments of $541. You know, advanced cataract surgery on a monthly payment with no interest can be somewhere $84 to $125. And I think, you know, if you take a look at the time spent, again, breaking it down, why do we use more than our vision? 100% of the time. Then, you know, this has kind of always been a thing that I always like to point out. So if you think about it, after 2 years, if you stop paying your cell phone bill, your cable bill, or your car bill, you know, unless you have the car and you own it now, it gets repossessed and they turn off your cell phone and they turn it for cable TV. You know, when you talk about your vision, you've made an investment in it, but at that point, the vision is paid for. It's something you're going to have for the rest of your life, and there's no future payment on it. So it's discouraging, yes, that there has to be money associated with it, but I think if you look at it in different ways, it's much easier to understand.
Yeah. And this is just pointing out that we're very careful with the COVID. We've followed every CDC guideline and followed them appropriately. Everyone in the offices when you're coming in is masked. We have people walking around, wiping down all surfaces. You're safer in our place than you are probably most anywhere else, like stores or anywhere else you go. So I wouldn't be overly worried. We're monitoring ourselves carefully, and if anyone has a symptom, they get tested, etc. So I want to reassure you, it's for our benefit as well as your own to stay healthy and stay safe.
Do we have any questions that we wanted to from the audience?
A couple questions. How is custom cataract surgery different than LASIK and other vision correction?
Okay, that's pretty. So when we talk about LASIK or PRK or what you hear laser vision corrective surgery, that's done on the very surface of the eye. So you're taking the glass prescription and we're using a laser to reshape the very surface of the eye, okay? And it's a great procedure. What we're talking about when we talk about cataract surgery is we're actually going inside the eye, removing the natural lens that we were born with and replacing it with an artificial lens. And I will also tell you this, that laser vision correction, LASIK, PRK are very good procedures and people do well with them. But you might have heard people needing enhancements or their vision actually develop cataract. When we do cataract surgery, this is a very permanent and stable type vision that you get afterwards. And as long as your eye stays healthy, you don't develop a diabetes, macular degeneration, glaucoma, other things, as long as the eye itself stays pretty healthy, the vision you get after cataract surgery is really something that you will maintain throughout the rest of your life.
Yeah, and that just a comment. Laser vision correction is most often for people that are generally under 45 years old, and it's just one place in focus, like they're trying to get their distance very good. In cataract surgery, again, as Rich said, Dr. Roth said, we're going into the eye, taking the lens out, putting a new lens in, and we can do better than laser vision correction because we can give you distance and near back. So it's similar in that you're fixing your vision and getting rid of glasses, but totally different methodologies and different surgeries.
And I really think when you would think with advanced cataract surgery in modern times, it's cataract surgery and refractive surgery put together.
Yeah.
So we're actually not only customing your eye, we're getting rid of that. So we're really blending two different things and we brought them together. That's why a lot of people you'll hear in the future is cataract refractive surgeon, because we're really combining those two fields.
Right.
Great, thank you, docs. For anybody who joined a little bit late, there is a chat bar on the right side of your screen. You can feel free to type in questions there and we'll get to as many questions as possible. One of the other questions is, what is the recovery time after surgery?
So you leave, first of all, you leave seeing that day. Now your vision that day might not be crystal clear. It is not going to be crystal clear, but you leave seeing that day. And over the next few days, your vision will get better and better. Remember, we put a new lens in your eye. So there is what we call a little neural adaptation where you're getting used to that new vision. If you've had your first eye done, your second eye hasn't been done yet, you might have a little disparity. So, you know, there's a little time where you adapt to your new vision, but you're seeing that day, and the vision typically will get a little better over the first couple of days. It's a little scratchiness with your eye. Again, you're up showering the next day, you're doing most of your activities. We don't want you lifting heavier than 10 or 15 pounds in the first 5 days. You know, if you're someone who works out at the gym, we're going to tell you to take it easy for the first 5 days. But that's really it. If you're a big time swimmer, we don't want you submerging your head in a pool underneath for about 2 weeks. But beyond that, you're back to normal things.
Okay, great. On the cost slide that was up before, the $3,000 figure, was that for the advanced and the dropless cataract surgery?
So in those packages, everyone gets dropless cataract surgery. We do these days. For the advanced, we have tiers in the advanced cataract surgery. So one is where we kind of focus on giving you either great distance or great near. Obviously, more people go with distance. And then in the visual freedom, where we're giving more of a range, that's a little higher tier. But all those things, you know, are included within those packages. What I should say is we're going to use the appropriate technology that we have at our hands to get you to your goal.
Okay. And another question, how long does surgery last? Like how many years after you have cataract surgery?
I think Dr. Roth commented, it really is permanent. There's very, you know, the thing that's changing in your life is your lens. So once we take the lens out and replace it, it's not going to change very much at all. Maybe just a slight shift over many years, but it's permanent. Sometimes people will have a little haziness develop a couple years later or so, and that's because the membrane that holds the lens implant in place was around your natural lens, and as that holds the new implant, it can get a little bit cloudy or hazy, almost like a window in the car gets kind of some stuff on it and it spritz off the windshield, now you can see again. So we use a little laser to clear away that haze. That's covered by insurance plans. It's often done only once to each eye. Within about 30 or 40% of people will get that within a few years. So that's what people say, oh, my cataract came back. It can't come back, it's gone. And then it's permanent until, you know, whatever the future holds for you. Like if there's no other eye care disease states going to come up, diabetes, glaucoma, macular degeneration, then you'll maintain good vision for the rest of your life.
Yep.
Great, thank you. I have an appointment in December for a regular eye check. Should I cancel if I want to have a cataract consultation?
I'll jump on that. If you have cataracts and you know you do, whether someone saw it and told you that, or you, again, if you've been told, there's no real need to go to your regular eye exam. You certainly can, don't get me wrong, but they're probably just going to send you for a cataract evaluation. So again, if you know you have cataracts, you can just call us directly and make an appointment. If you don't know, or if you're just blurry and things are just not as clear as you may like it to be, then I would keep that appointment and get seen. Dr. Roth and I are primarily surgeons, so we don't see people for regular eye checks. We see them if they have a problem or they need surgery. So that's kind of how I handle that.
Okay, great questions, by the way, guys. Question, can glaucoma be addressed at the same time as cataract surgery?
Yes. So it depends on, again, there's a couple questions that go in there. in modern cataract surgery, yes, there are different procedures that can be done at the same time as cataract surgery. And it really depends on the degree of glaucoma you have. Is it something that you're really low end or kind of moderate, you're just taking a drop and that's fine? Is it something that you have significant damage? So there's a spectrum, and depending where you are in that spectrum is what we want to do. So that's something that can be evaluated at that time. Obviously, if we felt that you needed a more aggressive procedure for glaucoma at the time of cataract surgery, we may have you see one of our cataract specialists who would do, or glaucoma specialists who would do that. If it's something on the lower end, that's something we can handle. So it's really part of that important evaluation to find out. But yes, it can be sometimes addressed at the same time.
Okay, where are we located and where is surgery performed?
We're located, the main office that we're speaking to you from is on 703 Rudder Avenue. If you drive on Rudder Avenue, right before, as you head toward the Cross Valley, we're a big building on the right-hand side that has an eye on the outside. Our surgery is done on Wells Street, so it's only about a half a mile away. And our schedulers will tell you where everything is. We also do surgery in remote locations. Dr. Roth heads to Hazleton and does surgery there, and also to Scranton. I think those are our only two others now.
I think right now, especially with COVID, we used to do a couple more, but it's been challenging. So probably, you know, at this, I hate to say it, we're coming to a year where we've kind of done that. But also, I think the importance of, you know, our surgery centers is really focused. We do a lot of cataracts, so our staff is very focused. All of our equipment is there. You know, a lot of times when we go to some of the outside places, and that's fine, but we have days where they kind of bring the equipment in and out. So, you know, ours is really a freestanding eye surgery center.
Okay. Is this procedure safe for people with autoimmune conditions? And what types of antibiotics are used? If it's a complicated case, should it be done in a hospital setting?
So I have never seen, I've probably done 35,000 cataracts. Rich has probably done, if not, you know, close to that number. I have never seen a reaction. Actually, it's a very good story. Cataract surgery with the current lens implants came about because in World War II, fighter pilots that would get hit with shrapnel and not be disabled but make it back, if they happen to have a piece of their windshield that, you know, it sounds terrible, that penetrated the eye but didn't hurt the eye too terribly, it would be tolerated. So all of a sudden, a smart man decided to make these lens implants out of this material. So as time's gone by, the material of different types have been tested. And these are inert materials, which means the eye doesn't recognize it as foreign. So even with autoimmune diseases, that's not a concern. Autoimmune diseases bring up other issues. We would like everyone to be as healthy as they possibly can be, but we've done some very sick people that have a lot of diseases. And eye surgery is a very selective location to have things done. So it's generally not something you should overly worry about. We do use antibiotics in the eye, and the antibiotics we use are fluoroquinolones, which are very strong but gentle antibiotics. If you're allergic to that, we won't use that. And we use topical eye drops. That may be a time that we do. So we're careful to make sure we get your history. We frankly, at this point, still have everyone see their family physician to clear them from any major medical issues that we should be made aware of. So it's done with your best health in our first foremost of our mind. Foremost.
And I think, Cheryl, just to finish up on that, there was a question, hospital-based versus surgery center-based. We do all of our surgery in a surgery center. So the biggest thing is for patients, it really comes down in that case, if they're healthy enough. You know, there are certain patients who may, because of systemic health issues, may best serve to have surgery at a hospital, but that's pretty rare in modern times.
And if need be, we'll deal with that then. Yeah, we'll refer them.
Okay, great answers. I'm going to combine a couple questions here. We're asking if the vision is extremely bad, is the surgery performed in both eyes, and do you have to have both eyes done?
So currently, we do not do surgery at the same time in both eyes. So in other words, we don't do right eye and left eye on the same day. I will say that I think it's something that we'll probably move to in 5 years. There are some large studies being done in the United States of same-day surgery the safety and things of that nature. But currently we do one eye. The other eye can typically be done in anywhere from later in that week to 2 weeks to a month. Does surgery have to be done in both eyes? Some patients, I would say rarely in modern times, because as we talked about how general the surgery is, how quick the recovery is, how there's not downtime with it. So most patients will have their first eye done and come and say, when am I having my second eye done? Every now and then we will have a patient that says, I had my first eye done, I'm happy with my vision, I feel like I'm functioning well, I'm gonna wait, and that's okay. So do you have to have both eyes done? No, the other eye won't get better, but if you're functioning well and you're happy, that can, yes, sometimes patients won't have that. It's rare, but yes.
One thing I will say, the old history, remember we used to use the words ripe, so we wait till a cataract is ripe or very dense. In that case, we wanted it that way because the technology was such that we made a very large incision, as you saw in an earlier slide, with multiple stitches. And that's because we almost like took the cataract out like you'd squirt a pea out of a pod. So nowadays, because we break it up in place with little tiny incisions that don't require sutures, we really don't want that cataract to get so right that we have to use high energy and increase the risk, the surgical risk of the surgery. So, you know, we may say to someone, look, your cataract's getting pretty dense. I mean, if we're going to do this, it's better done sooner than later. But it is your decision. The patient makes the decision. And most people, when we're done with one eye, are usually happy enough to saying, wow, let's get the other one done now. Let me go back on the table. So it's generally a positive event. This is one of those events that are meant to improve your lifestyle. This is not being done because, God forbid, you have to have a leg cut off because you have horrible whatever. This is a positive thing. It's a good thing. So most people, and it's meant for people that are getting on in life. So it's a good experience. The idea is scary. When I have somebody who says to me, I'm not scared at all, that's a little unusual. I think you should be a little scared, but you have to have faith and you ask the good Lord to give you a good outcome, and we'll take good care of you, and you should do very well. So in the end, most people are very, very happy and want their second eye done, but it is entirely up to you.
Okay, great. I'm a diabetic and have macular degeneration. Is the advanced surgery for me?
Well, I think I'm going to let Dr. Reiser talk because you were involved in the study for this, so he has a little more knowledge on it, just a little.
You know, the answer is yes. Advanced cataract surgery really is for everybody. I mean, to use 40-year-old technology is certainly fine to do, but you know, if we're shooting for our best visual outcome, if you can afford the upgrades, that's what you should do. If I was buying a brand new car of today, right now, 2020, would I buy a brand new 1985 car? I wouldn't. And it's a great car, work well. So the answer is it's for you, but some of those choices, the distance and near lens, may not make sense for you. So we will not let you do something that does not make sense. I believe the advantage of the precision, accuracy, safety, gentleness of laser assistance and better technology of today is worth it for everybody. But that being said, we will probably tell you it's not worth it to spend the extra for a distance and near lens. Let's get the best visual quality you can get for this lens. Or if you don't have terrible macular degeneration and terrible diabetes, if you don't have that, then maybe one of these distance and near lenses that are very forgiving may be a great choice for you. So each person is different, and our experience will help you make that decision.
Mm-hmm.
Great. Can you get a Clarity Plus package in one eye and the basic in the other eye?
Yeah, explain the Clarity Plus. It's not on the slides.
Yeah. You can, you know, and there are certain situations where a patient may come in and, you know, really need a special toric lens in the right eye, because every now and then we'll run into a patient who has very, very high astigmatism in one eye, and in their other eye really has no astigmatism. So a basic surgery they might do well with, and we would talk about that. Again, the general rule is we really want to make sure that we're matching the vision in both eyes, because when you have binocularity, both eyes working together is really when you have the best vision you can.
And let me just touch the words Clarity Plus. I apologize, the slides don't show that to you. Advanced or custom cataract surgery has packages underneath. One is Visual Freedom, which is distance and near. Clarity Plus is the best quality distance we can give you, accessing the laser if appropriate, or better lenses. And there's Clarity where there's other limitations. So without getting too complicated, the overall package is advanced cataract surgery. Clarity Plus is one of those, which is highlighted toward distance usually.
Okay. And one last question. If someone is scheduled already for surgery somewhere else, they were told they have astigmatism and they were told they'd have to wear reading glasses, what do you recommend?
Come in and see us.
Yeah, come and see us. We'll take care of both.
That was a real question, not a setup. I left out some of the details.
I just want to say, I really do think Rich and I mean, we are committed to being on the cutting edge, not over the cutting edge. We like to be involved in what's working best. And we were privileged by the patients in Northeastern Pennsylvania letting us be involved in studies for many of the current lenses that have been approved by the FDA. So we really know these quite well. We know what they do best in. We know how the astigmatism works. So while I think there are many excellent surgeons all around, I don't think anybody's better than we are. And I'm not saying that in a way meant to be obnoxious. I'm saying that in a truthful manner.
Okay, and one last thing, there were some people who arrived late. So can you talk a little bit about the financing and how they might be able to afford it?
Sure. So, I mean, yes, there is an additional charge for, or an out-of-pocket cost, I guess, is what I would say, for advanced cataract surgery. Remember, insurance does pay at all the levels as we use more
Cheryl,
technology.
Go back on the slides that illustrate the different options, and just so you get a feel, because it has to be put in perspective. Here, go forward one more.
Forward one more.
Yeah, right there is good. Thank you.
Yeah.
Sorry.
So no problem. So I mean, insurance does pay at all levels. The more technology we have to use, because there's a cost to it, there's a charge for it. But we do have financing, that patients can use called Care Credit, where it is, I think it's no interest for 2 years, so it keeps the payments low. And as long as it's paid off in 2 years, you don't pay any interest on that. You want to go ahead and do it this time?
Yeah. So this is meant to illustrate, what is the value of your eyesight? Okay. Well, your cell phone costs you $100. We're just taking rough numbers. Frankly, if you have my 3 daughters and my wife, my cell phone bill's closer to like $350, but okay, per month, by the way. $145 a month, $123 for cable. Again, my cable is absurdly more than that. Car payments can be, $541. These are kind of averages that we took. Eye surgery, how often do you use your eyes, by the way? I mean, you use your smartphone once in a while, maybe even a lot. You watch TV when you get home, you drive your car to and from work or whatever. But you open your eyeballs pretty much all the time once you wake up. So vision costs less than all those things. And after 2 years, the rest of those years are free. You're not paying anything for the next. If you stop paying on your car, your cell phone, or your cable TV, you're not having that anymore. So in the perspective of what the cost is, I think it's very reasonable for what you're getting. And it is covering our costs to be able to provide that, because it's costing us for that technology as well. So we try and do everything we can to make it affordable for people. And that's how it is.
Yeah, there were some pricing questions, and what we recommend is that you come in and speak with our counselors and talk directly about your specific recommendation, because you may or may not be a candidate for all of these procedures. Let the doctors recommend what's best for you. A reminder, if you'd like us to call you and schedule an appointment, please feel free to type it in the chat bar and type any comments that might help us for future seminars. Our number is right there on the screen, and our website as well, where you can find more information. We really appreciate you joining us tonight. Thank you so very much, and have a great evening, and everyone stay safe.
Thank you very much. Appreciate it.
Bye-bye.
Yep. Bye-bye.